do people wake up in the middle of the night with asthma?
Yeah, commonly. It's interesting. At night, if you look at asthmatics, they have more airway inflammation, more eosinophil infiltrates at night. And 3 o'clock in the morning is the magic hour. That's when it wakes them up.
When they wake up with asthma, 3 a.m., what do they have to do to get better?
They need a reliever medication or their rescue medication.
So, like, what is a reliever or rescue medication?
That would be a medication like albuterol, a bronchodilator, a short-acting bronchodilator. Take a puff or two, it works quickly to open the airway.
So it opens the airway, relieves the episode of the wheezing in the middle of the night.
Yes, but it doesn't do anything for the inflammation.
Now, so the inflammation is important. Why do people get inflammation? When you say inflammation, what do you mean?
Yeah, inflammation of the airway, these are inflammatory cells that migrate into the lung. They lead to inflammatory changes, mucosal thickening, which results in narrowing of the airway. But another question is, well, why do they get that inflammation in the first place? Well, allergic triggers, things they breathe in the spring and the fall. A lot of people become allergic to dust mites or animal dander in their home, work environment, but it doesn't have to be allergens. It can be the common cold, one of the most common triggers for enhanced airway inflammation in asthmatic patients. Exercise, the cold, dry air of winter, a number of emotion even can stimulate.
Okay, somebody got through the attack, but they still have the diagnosis of asthma, and they still have problems in the middle of the night, or they have problems when they're exercising. What else can you do? You mentioned the word inflammation. How do you treat that?
Yeah. So there's some people with intermittent asthma. There's some patients with persistent asthma. The persistent patients need their reliever, but that's not going to fix the inflammation. They need anti-inflammatory medications. We have a number of those. We have leukotriene receptor antagonist, which is a pill.
Leukotriene antagonist receptors?
Yes.
Yeah. Okay, like what?
Like Singulair or Montelukast.
Will they help?
They will help, but it's not your go-to first-line medication. It's an add-on therapy. The kind of the cornerstone for treating a persistent asthmatic patient, the drug that you build around are inhaled corticosteroids.